This video details rehabilitation following labral debridement, cam and/or pincer takedown, or labral repair or reconstruction. Phase 1, immediate post-operative stage, 1 to 14 days. Let's begin by briefly discussing the importance of prehab. Getting specific muscles stronger and flexible helps speed up certain portions of the rehab process. You need to focus on strengthening the gluteus medius muscle and the core muscles of the trunk, including the transverse abdominis and multifidus. You can find a prehab program on our website. Prior to your procedure, you will be fitted for crutches and put through a Biodex isokinetic test to assess the strength of the quadriceps of your surgical leg compared to your non-involved leg. A functional step-down test will also be performed. This gives the surgeon and your therapist baseline data to refer to during your rehab phase. With patients with bilateral hip problems and planned stage surgery, the more involved side is compared to the less involved side. During the immediate post-op stage, patients are recovering from the pain of the surgical procedure. Every patient is advised to rent a game-ready cryotherapy system for home. This ice and compression unit is vital and will be utilized to control your inflammation and pain at home. You will wake up in the recovery room after surgery with the system already on you, immediately starting the process of your recovery. You will go home the day of surgery with crutches and put no weight down on your involved foot. The surgery requires general anesthesia, and you will also have a regional nerve block performed by the anesthesiologist. This substantially reduces your pain after surgery. Patients attend physical therapy the day after surgery, immediately following their appointment with the surgeon. Usually pain is well controlled due to the regional nerve block. You will have been non-weight bearing due to this nerve block. At your first visit with your physical therapist, after seeing your surgeon, weight bearing will be initiated. The amount determined by the procedure you had done. Day 1 of PT consists of an introduction to a variety of exercises aimed at waking up the various muscle groups surrounding the hip joint while encouraging gentle range of motion, especially into hip extension. Your therapist will also review any restrictions or precautions you may have. If you had a labral repair or reconstruction, you will be limited to 90 degrees of hip flexion and not allowed to rotate your leg away from your midline. Due to these restrictions, you will need to avoid activities such as sitting in low chairs, bending over to tie your shoes, or sitting with your ankle on your opposite knee. All patients will be using crutches after surgery. Weight-bearing restrictions are put in effect to minimize undue stress at the surgical site. If you had a labral debridement, cam and/or pincer takedown, you will be weight-bearing as tolerated with crutches. If you had a labral repair or reconstruction, you will be partial weight-bearing, which is 50% of your weight through the involved leg. Patients who underwent a microfracture or cartilage repair will be limited to 20% weight-bearing and will utilize crutches for 8 weeks. Gluteus medius repairs will be minimal weight-bearing for 4 weeks. At week 4, you will be able to fully submerge in water to allow for normal bathing, etc. At this time, your therapist may initiate gait training in an aquatic treadmill. This will allow for normalizing step length and proper weight bearing without the use of assistive devices. If your therapist has an anti-gravity treadmill, such as the Alta G, you will be able to start independent gait training even sooner. You will not have to use a continuous passive motion machine for range of motion at home for any of these hip procedures. You will only be fitted with a brace post-operatively if you had a gluteus medius or hip capsule repair. If you are a candidate for bilateral hip procedures, please note that the shortest interval between surgeries will be at least 6 weeks. This includes all procedures. Phase 2, subacute phase, 2 to 4 weeks. In this stage, the acute surgical pain is beginning to subside, tempting a lot of patients to walk without crutches. It is important to continue compliance using the crutches until week 4. At week 4, your therapist will begin to wean you off crutches. The typical progression is from 2 crutches with full weight bearing to 1 crutch to off all crutches completely by week 6. Range of motion restrictions will be lifted for those patients who had labral repair or reconstruction at week 4. Your therapist will begin to work on increasing your range of motion by using stretching and range of motion exercises in combination with manual therapy such as joint mobilization, soft tissue mobilization, and dry needling. Your physical therapist will begin to progress your exercises to include weight-bearing activities that incorporate core and hip stabilization. Towards the end of the stage, you may begin progression into light cardio activity. Each patient will be different in their rate of progression, so specifics should be discussed with the doctor and physical therapist before new activities are added. During this time, we occasionally see the beginning of inflammation of the erectus femoris muscle, that is, hip flexor tendinitis. This can occur due to an overuse of your quads and underutilization of your glutes and core. Your physical therapist will guide you in a continued quad and hip flexor stretching program with an emphasis on utilization of hip and core stabilizers to prevent compensatory patterns. Phase 3, intermediate stage, 1 to 4 months. This is the stage when most people return to normal daily activity without much pain and begin increasing their cardio activity. Some patients continue to deal with hip flexor and/or quad issues. It is important for your therapist to slowly progress your cardio activity to prevent overuse and continue to emphasize the stability of your hips, pelvis, and spine to prevent compensation and inflammation. In PT, the exercises begin to become more fun and challenging, incorporating the use of balls and balance equipment. At week 12, you will undergo a second Biodex isokinetic test, which will look at the strength of your quadricep of your surgery leg compared to your non-involved leg. We look for a deficit in strength less than 20% of your uninvolved leg to progress activity. We compare this test to your preoperative Biodex test. At this time, you will also repeat the forward step down test. Phase 4, advanced phase, return to sport, 4 to 6 months. As physical therapists, we look for excellent hip and core stabilization during this stage in order to progress you to higher intensity activity, including running and jumping. Formal physical therapy comes to an end during this stage. You will be given a thorough home exercise program to ensure continued hip and core stabilization. The Biodex test will be repeated again if you did not achieve less than a 20% deficit at week 12. Once a value of 20% or less deficit is accomplished and excellent hip and core stability is established, you will be allowed to progress to sports. Depending on your goals before allowing return to sport, additional functional testing may be performed, incorporating jumping and landing mechanics. Remember, the recovery time for these procedures depends on how long you have been experiencing symptoms. The longer you were symptomatic, the longer you can expect the recovery phase to be, as time zero for many patients is not the day of surgery, but it is the moment symptoms first appeared. Typical time to recovery for for most patients is 3 to 4 months. High-performance elite athletes may require 4 to 6 months or longer to work on sports-specific training. In this case, clearance may involve a Bidex isokinetic test with a less than 10% difference and passing several functional sport-specific drills.